Hi, I'm Sharon Anderson, president of Leiomyosarcoma Support and Direct Research Foundation, LMSDR for short. And I want us to welcome Dr. Gina D'Amato from University of Miami. She's an oncologist in the sarcoma program. And today we're going to discuss short and long-term side effects and how to manage them. So Dr. D'Amato, you want to take it away?
Sure. Okay. Well, welcome everybody. Oh, I have to press OK to be recorded. Okay. Welcome everybody. I wanted to make this talk, not so formal. So I do have some slides, but hopefully, we don't have to go, by the book on the slides. I think, side effects and side effect management is very, very important. I think that the key takeaway is that any treatment that we have is going to have some side effects, but the majority of side effects we can manage with another medication. So, sometimes people are, before you had cancer, you never took any medicines, or you may even be against medication. And now all of a sudden we're giving you medicines and then more medicines and more medicines. But if we can keep you on treatment, patients that are on treatment, and the better they tolerate it, the longer they can be on the treatment, the more effective the treatment could be, and that can improve your survival. So if you want to be on a treatment that's working, but you want to have quality of life. So we want to make people live longer, and we want to make people have the best quality of life possible. And so how to do that is to have you on treatment if you need it. Not everyone needs treatment all the time. And let's get you through it. And it's 2025, so we don't want anyone suffering, and we don't want anyone having side effects that unnecessarily. Okay. So let me see if I can share my slides here. Let me know if you guys can see, because I tried to make it home so I
Yes,
can use my
yes.
dual monitors, but I got stuck in the clinic and I'm still here. So I don't even have my fancy background. But anyways, let me
Well, I
see.
see it. It's up.
Okay. Okay. And let's see slideshow. Okay. Let's see if we go to slideshow from beginning.
Yeah,
Oh, it's one of these things over here. Uh-oh. Okay. What just happened? I don't know what just happened, but
me either.
maybe we won't do slideshow. Hold on. Sorry, guys. Okay. You know what? We're just not going to have the slideshow because, okay.
There we go.
You guys will see my little cheat sheet on the side and whatever else is on the other side. That's fine. Okay. So managing, and I just want to thank Sharon and Susie for inviting me and this great group of leiomyosarcoma support direct.
Research.
Obviously, I tried to do this and it was blurred out, but you guys know who you are. So thank you so much for having me today.
We just say LMSDR. That's easier.
LMSDR, because
There you go.
LMSDR. Okay. So I'm an MLS doctor. So that's what I've been right now. Okay. I know DR doesn't stand for that, but anyways. Okay. So we want to cope with leiomyosarcoma. So there's physical and emotional effects, and I'm going to go over those. Okay. Now, some of the side effects that you have are from your cancer, right? And we have to be able to figure out what's the side effect from the cancer, what's the side effect from the treatment, and be able to target both of those. So, you could have side effects from treatments. We're going to be looking at all this, and side effects from the LMS: pain, bleeding, nausea, vomiting, diarrhea, constipation, fatigue, edema. Those are some of the side effects that you can get from LMS. And then there's many different side effects that you can have based on what the treatment is. So low white blood cells, you can susceptible to infections, low red blood cells, anemia, low platelets can cause bleeding. You can have all kinds of GI issues: nausea, vomiting, diarrhea, constipation, hemorrhoids, mouth sores, rash, skin changes, color changes, fatigue, weight loss, weight gain, low blood pressure, high blood pressure, heart damage, infertility, and secondary cancer. So, not every drug has all these potential side effects, and I'm missing some of them. I had a slide that I wanted to add in last minute of which treatments can cause what, but I think the main thing is let's go over the ones that are the most troubling to people, and we'll focus on those. And then I won't take up too much time because I want people to ask questions and have it interactive. So because I'm sharing my slides, I may not be able to see you raise your hand or whatever, because I can kind of see some of you, but not all of you. So you can either speak up, or maybe Sharon or Susie can kind of, ask, kind of interrupt me, but I'm fine to be interrupted because I can ramble. Okay. Okay.
So
Let's talk about nausea. I would say the majority of our cancer treatments cause nausea. Okay. Not all of them do, but I would say the majority. Now, if you have tumors in your abdomen and pelvis, that can also cause nausea. What are other causes of nausea that's not related to the treatment? Okay. Pain can cause nausea. Anxiety. What do you think sick to your stomach is? Right? Constipation, dehydration, malnutrition, reflux, certain foods, motion sickness, infections, tumors, and medication. So we don't always want to blame the medication on the nausea, right? Or the nausea. We don't always want to blame it on the medication. We want to figure out what's causing the nausea and what are things that we can do, okay? So if it's the treatment, what do we do for nausea? First of all, we want to figure out what's causing the nausea. Can we pinpoint it? When do you get nauseated at a certain time? A good idea is to keep logs of things, of how you're feeling. Are you having pain? Did you eat something? It's hard to do, but you can write these things down, or nowadays, people do, you can have all kinds of apps and you don't even have to write stuff. But I'm kind of an old-fashioned kind of person, so I like to write things down. But got to figure out, is it when you take a certain medicine that causes the nausea? And avoid triggers of the nausea. So sometimes, like I, for example, have motion sickness and I forget that I have motion sickness. So I have a weak stomach and I'm not on chemo and I don't have cancer, but I still get nauseated a lot of times. So that's why I know all the other potential causes of nausea. And so if you already had maybe a baseline motion sickness you didn't even realize, then you're on cancer treatment, that can make things worse. So some of the triggers, if you know that some people, I don't know if you have a show of hands who gets sick, car sick, right? Or if you're trying to go in the back seat and you're reading. So sometimes you definitely don't want to read, right? But what about your phone? You're always looking at your phone and you're always texting, and you read the text and then you forget that you're actually get car sick, and then all of a sudden you vomit. So this is speaking from experience, but other patients as well. So you want to be no texting and driving. You want to be trying to avoid looking at your phone when you're in a moving object. Try to avoid that. It's hard to do, but and obviously when you're driving, no texting and driving, but when you're a passenger, we're not going to go down that lecture of texting and driving. Dehydration, okay? People, you want to be looking at your urine, okay? You want to be drinking the amount that you weigh, half of that in ounces at least. So if you weigh 150 pounds, you need to be having 75 ounces of fluid a day, which is about 3 liters of fluid, okay? Each of those two to 3 liters of fluid. Each of the liter bottles are 32 ounces. So you need to have 2 or 3 of those, okay? So it depends on how much you weigh. And you need to look at your urine. I tell patients, if you're not drinking enough fluid, if you're not going to the bathroom and you're not annoyed by how many times you have to go to the bathroom, you're not drinking enough fluid. So dehydration can cause it. And also you want to keep your pain level less than 2. Pain can cause nausea. So a lot of people are resistant to taking pain medicines because, oh, the stigma of pain medicines and everything. But these pain medicines were designed for cancer patients, not for people that don't have cancer. And so you really want to be taking advantage of the pain medicines and get your pain under control, because that can cause nausea. And then we have some home remedies. We have home remedies like ginger tea, and then we have all the antiemetics, right? So we have all the antiemetic medication. So first, the causes, we want to address the pain. We want to see, is anxiety, are you going to your mental health counselor? Are you talking to your doctor about your anxiety? Are you constipated? Let's move the bowels. If you're constipated, you're going to be nauseated. Are you dehydrated? If you're not eating enough and you're not filling up your stomach, that can cause nausea. Reflux. I have most of my patients, if they're on any kind of chemotherapy, I have them on an antiemetic. I mean, a proton pump inhibitor, an antacid. So like pantoprazole or omeprazole, so like Protonix or Nexium or whatever. And I have them on the proton pump inhibitor, the antacid, from the beginning of the chemotherapy to at least 3 months after the chemotherapy, because it tears up your stomach. Now, some of the oral medications like Votrient, pazopanib, and some of the oral medications, there's an interaction, and the pharmacist will tell you you're not allowed to take that. But actually, you can if you separate it within 12 hours. So talk to your doctor about that. And then certain foods, you want to, again, if you keep your pain diary, you may notice that certain foods, you may not realize that you're lactose intolerant, you don't realize before, or you did, but you were in denial about it like me. Okay. And then infections. A lot of times, I will find someone will say they're nauseated, and I will find that they have a hidden urinary tract infection. So I always check the urine. I like to check the urine. You want to be smelling your urine. Does it smell funky? Okay. If it smells funky, it looks bad, you want to get that sample, because patients that are on chemotherapy and any kind of cancer therapy, but besides maybe immunotherapy, are at risk of infections, especially urinary tract infections. It's one of the first things. And the older you get, the less likely you're going to have the side effect. You're going to have the symptom of a urinary tract infection, like that burning, because that's what happens when you're older. You just don't get that. And you can have hidden urinary tract infections. Men also, they don't really get that kind of burning. And then you may be on pain medicine. And if you're on pain medicine, you're not going to feel the burning. Okay. And then of course, certain areas, if the tumor is pressing on certain things, and, we may be able to radiate that tumor or whatever, we want to control that. And then antiemetics. Antiemetics are your friend. Okay. So we've covered all the things that you need to do besides taking medicine, right? Medications. So I would say the first line medication that we use is Zofran or ondansetron. That usually works pretty well. Some people get headaches from that. If you do get headaches from that, there's other medicines. You can take headache medicine, but it's better just to try different antiemetics. Some people just really don't do well with the Zofran. Now, of course, the Zofran, hold on one second. I'm just going to shut this door because I'm hanging out with the janitors. They were trying to come in, so sorry about that. Anyways, so the Zofran also can cause constipation. So some people don't like to take that, but we're going to have a whole thing on constipation. And so sometimes you have nausea, you have to take a Zofran, and you have to take a stool softener and a laxative. But you know what? Your bowels are good and you're not nauseated and you're not vomiting, so that's good. Okay. We also, Ativan can help. So there's 3 kinds of nausea that's associated with treatment. Okay. 3 times. There's the acute nausea that happens while you're getting the treatment. Okay. Which is common in chemotherapy. But if you are on an oral medication like Votrient, it's happening every day. So the acute nausea, the Zofran is very good for that. If you notice, if you start a new medication that's an oral medication, you may not have to take the Zofran right before. Maybe you can try it 1 or 2 days before, 1 or 2 days without it. But if you notice that you need to take it, then you just take it every day, 30 minutes before, as a preventative. And that's what we do for chemotherapy. We give you lots of antiemetics, medicate in your pre-meds. That's what's in your pre-meds. So that's what we do in your pre-meds. Now, some chemotherapies cause delayed nausea and vomiting. Some chemotherapies like ifosfamide, cisplatin, which you don't get for leiomyosarcoma, but ifosfamide, doxorubicin, not necessarily, maybe a little bit of Taxotere chemotherapy can cause some delayed nausea. And so there's another drug on lands, there's another drug, Aloxi, that's IV, that we give and amend, that we can give in the chemo. And that will, with the pre-med, and that will help. But, and then we have anticipatory nausea. So anticipatory nausea is related a little bit to anxiety, but it's a little bit different. And that it's, you had a bad experience with chemotherapy once, or even your friend had a bad experience with chemotherapy once. You're driving up, you're ready for your chemo, you already start nauseated, you haven't even gotten the chemo yet. Okay, the thought of driving, you're on your way there, you're driving there, or you're getting a ride and you're not looking at your phone. Now remember, don't look at the phone while you're driving. Okay, you get nauseated, that's anticipatory nausea. The best drug for that is Ativan lorazepam, because it's related to, but also lorazepam also can be helpful for nausea. The Zofran does not cause you to be having side effect fatigue, but the lorazepam and the compazine and the phenergan can. But some people like the lorazepam, the compazine and phenergan. Compazine and phenergan are kind of old school. That's what we used to use before we had Zofran. Reglan is another kind of hidden secret, especially for people that have GI tumors in your abdomen, because that can cause the motion, the food not to go down properly, and the Reglan kind of helps with the moving the food down. And then there are patches, like if the Zofran does work for you, but you don't want to be taking it all the time, there's a Sancuso patch that can be helpful. It's expensive, but the company does have some discounts, and you can usually find coupons and things like that, and get some free samples. Another newer drug that is called olanzapine. It's also called Zyprexa. It's an antipsychotic, so people freak out. They're like, what? I give, and it works wonders at night, especially for people that are on chemotherapy. There's another chemotherapy that we give that's an oral chemotherapy called Timidar or temozolomide. And you have to take that every day, or you know, in a regimen. And so that, or if you're on an IV chemotherapy, it's very effective. You just take it at night while you're on the chemotherapy, and just don't freak out when, you know, it says antipsychotic, because I just actually was with a patient today, and I'm like, oh, well, have you tried the olanzapine? No, she read it that it was for psychotic, and no, she didn't want to do it. So I'm like, no, don't. All these drugs work on different receptors in the brain. And so, you know, they're similar to the antidepressants or anti-anxiety, because it's all kind of linked with the receptors, but don't be alarmed. Okay. Other additional tips: take your anti-medicines as instructed. Okay. Eat small meals a day instead of 3 large meals. A lot of people are used to like 3 large meals. No, your stomach may be smaller from your tumors, or it may be smaller, you know, because, you know, your stomach is irritated from the treatment. So just have small meals throughout the day. Drink clear liquids as often as possible, okay, to prevent vomiting. Freshen your mouth with some mouthwash and sorry, with baking soda. That can help. A little spit, swish it around and spit. And try some blander foods. and try to, like the ones that are really fatty or very sweet, spicy, you may want to try to avoid those. And then some dry foods like crackers, toast, breadsticks. And then every few hours, make sure that you're taking don't say, oh no, I'm going to hold off. Just take it, because once you vomit, then it's like a whole thing. Then it's like, then you get dehydrated, but then which then causes nausea. And then you get the anticipatory nausea, because then you remembered that you vomited, so you really have to stop it. Other things that you can do is, if you're really feeling like you can't get it in and you're nausea, call your doctor. IV fluids are a wonderful thing. If you're a little dehydrated and you can and you're feeling nausea, just ask your doctor to do the IV fluids, and that really can help with nausea. And sometimes they can give a little IV nausea medication in there. I usually set patients up if they're on chemotherapy. I usually set them up already, reserve a chair for IV fluids and labs 2 to 3 times a week. They can always cancel it. This way, it can help avoid dehydration. Let's see. And then the small meal. Oh, is this a double? This is a little double. Okay. This is some other ones, like if your appetite is low, which is another thing. Remember, the chemotherapy and some medicines suppress the appetite, but we don't want you losing weight. Okay. And we need your body to be healthy and strong, so that it can handle the treatment and fight the cancer. So again, eating small meals a day, keep your pantry and freezer with small snacks, easy meals, tuna fish, sardines, peanut butter, soups, crackers, cottage cheese, hard-boiled eggs. Have a snack at bedtime. And then try to make it count with protein-rich foods like yogurts and protein. And then drink liquids throughout the day, and try to have some that has extra calories in there. And then while you're eating your meals, don't really drink, because that will fill you up. Okay, this is if you're having low appetite. Altered taste, that's another side effect from chemotherapy, and even the Votrient and things like that. So you can try like tart flavors like lemon wedges, lemonade, and try to avoid like acidic foods, because you can get mouth sores. Okay. You can have foods marinated in balsamic vinegar that has that kind of stronger taste, and just put more seasoning. And you kind of have to see, like, some people don't like the salty, some people like the sweet. And then frozen fruits, you can put them in the freezer and then they kind of taste real good. Like I don't know if anyone's ever had frozen grapes, are so good. You put them in the freezer and they're like little, things like that. And then before eating, you can use the mouthwash to switch around. And if you have the metallic taste in your mouth, try to avoid using metallic. You can use plastic, and you won't feel that. And canned fruits and vegetables, or drinking out of a can, you want to avoid that. Okay. Other GI stuff. We got diarrhea, we got constipation. Okay. Diarrhea, again, could be your tumor. Sometimes if you have abdominal tumors, that can cause some diarrhea. But it's mostly certain foods, medications. Some chemotherapies are associated with. Usually it's the gemcitabine taxotere regimen that causes the diarrhea. Usually the other ones kind of cause constipation, because we give you lots of nausea medications. But other things like Votrient, pazopanib, regorafenib, those can cause the diarrhea more, the oral medications. So you want to keep a food diary. You want to figure out what's causing it. Okay. And don't let it get to you. There are many medications that can counteract it. So the Imodium is over the counter, 2 pills after each loose stool, up to 16 pills. Don't read the package. The package will say, I'm only supposed to take this up to 3 days. That's because That's to protect the general public, because the general public should not have diarrhea. They need to figure out why they have the diarrhea. Don't be masking it. But you already know why you have the diarrhea. It's from your treatment. So you can take as much as you want. Okay. Usually, if the Imodium, if you're needing more than 8 pills of Imodium a day, it's not enough. You need something stronger. And then you have the prescription medicine Lomotil, okay? And then it's the same thing, 2 pills after each loose stool, up to 8 pills. And if that doesn't work, we have tincture of opium, okay? Like Alice in Wonderland, okay. Anyway, so a tincture of opium and which works really well. And then if we have to resort to, we can resort to octreotide, their subcutaneous injections, and that could really stop things. So there's no need for anybody. I have patients, they say, I don't want to leave the house because of diarrhea, and they are afraid and they're having accidents. We don't want that. We want people living their lives. And so there's no need for you to have diarrhea. Of course, we also want to make sure there's not an infection. So before we do all that, we want to blame it on the treatment, but it's certain infections. So we will ask you for stool samples. You want to ask your doctor, should we be checking? Some people with chemotherapy, we give antibiotics to prevent infections. And then when we give antibiotics to prevent infections, it causes another bacteria called C. diff. So we want to make sure that you don't have the C. diff. So you want to make sure it's not infectious. But once we've ruled that out, then there are plenty of medicines and there's no need to be suffering and not enjoying your life because you're afraid you need to be by a toilet. Okay. Other things, high fats and spicy foods. Choose low fiber bland foods. You can sip on broth, tomato juice. You want to make sure if you're having diarrhea, we need to replace those electrolytes. So you have to be seen by your doctor, and we may even need IV fluids and a lot of potassium. So add foods that have fiber to kind of thicken up it. So bananas, applesauce, so that whole good old fashioned brat diet. Limit the lactose and sugar and sorbitol, okay? That can cause it. And limit hot caffeinated beverages and watch out for medications containing magnesium. Okay. The opposite problem, constipation.
Both ends. Okay.
What?
We're covering both ends.
Yes, we're covering both ends, literally and figuratively. I didn't talk about the mouth sores up there, but yeah. So I know a little bit more about constipation than diarrhea, just because it's more common, and because of personal experience, which you guys get to know me when I give talks about GI and dizzy and nausea, because I got it all. Anyway, so what causes constipation? Dehydration. Okay, dehydration. And we can see if your urine is dark, you're not going to be able to poop, okay? Because you're dehydrated, okay? So look at your urine. Certain foods cause constipation, okay? And everybody's a little bit different, okay? Some people, bananas cause it. Some people, nuts cause it. Other times cheese cause it. You have to figure out what is causing your diet, what is yours. For me, it's rice. I love rice, but if you give me some rice, forget it. I'm not going to the bathroom for several days. Okay, so rice is another one. Rice is good if you have diarrhea. Rice is bad if you have constipation. And the tumor itself can cause it. Again, if you have abdominal, not everyone has abdominal tumors. Okay, but if you do, it can cause it. Treatment. Look at this, the same as hydrate. I don't know if you've been noticing a theme about hydration. Fruits and vegetables, okay? For me, spinach. If I don't eat my spinach, I'm not going to the bathroom, okay? I try to eat a bag of spinach every day. I like Popeye, okay? It doesn't happen every day because, sometimes I don't make it home on time. But anyways, green vegetables, very good. Your fruits, and you're supposed to have 4 servings of vegetables and 3 servings of fruit every day. So you want to get that. That's just in general wellness. Definitely can help move the bowels. But sometimes, despite all this, we need to do more than that, especially if you're on narcotic medication, oxycodone or morphine, or you're taking Zofran for nausea. Then you just have to say, you know what? I'm going to take medicine because we love meds. Okay. So stool softeners, usually we do stool softeners. Now, you have to be careful with the stool softeners because the prescription dose of a stool softener is 240 milligrams, but over the counter is 100 milligrams. So sometimes people say, oh, the stool softener didn't work. That's because you're taking the over counter dose. So you can ask your doctor to give you a prescription for the prescription dose. Now, likely when you go to fill it at the pharmacy, they're going to say, oh, it's over the counter. We're not going to pay for it. But then at least you know the dose. And then you can try to buy the 240 ones, or if you do, then the 100 ones, you got to like take 3 of them, whatever, but they're small. They're like little gel caps. You want to take that every day and the Miralax every day. And then if you haven't had a bowel movement in 2 days, then you can try Senna, you can try Docalax, you can try lactulose, mineral oil, whatever it takes for you to have a bowel movement every other or every 3rd day. You may not get it every day. That's okay. We just don't want it too long because then you wind up with what? Hemorrhoids, right? So then you have pain somewhere else. Okay. So that's the good way. Other things. Constipation, a lot of times people, it's like if they get out of their regimen, their daily regimen, and they don't have time, a lot of times people don't have time to go to the bathroom. And then if they don't have time to go to the bathroom, it builds up and builds up. You have to have that certain time. So if you eat kind of around the same time, you tend to have like a bowel movement around the same time every day. You want to drink your fluids. Again, 6 cups, at least 6 cups. So half your body weight in ounces. Okay. And then prune juice, warm fruit, caffeinated teas, hot water. Caffeine can help. Everyone says, oh, I just need my morning cup of coffee, that can help. And then gelatin fluids that include frozen liquid, like I'm not sure about this one. So we'll just have to, I don't know where I got this slide from, but I'm not sure about that. And then, you want to have your fiber. Okay. Swelling edema, leg swelling. Usually this is one of the side effects. Sorry, I'm going all over the place because I just like stole slides from other things, but you guys are okay with it, hopefully. But I don't know if we want to stop at GI issues or just keep going and then people will ask questions. I can't really see the chat, so I don't know if anybody has any questions about GI stuff.
Nothing in the chat.
Okay, good. Okay, swelling. A lot of times swelling can be a problem. Swelling could be caused by the tumors itself, okay? Medications can cause swelling. So some of the medications that cause swelling, Taxotere, gemcitabine, docetaxel, that can cause swelling. Some of the other tyrosine kinase inhibitors, like some can cause some swelling. Blood clots. So if you notice that your legs are swollen, you want to tell your doctor because it could be a blood clot. They'll do an ultrasound and make sure cancer patients are susceptible to blood clots. Poor nutrition. Okay, what happens is if you are malnourished, your albumin, which is a protein that is made in the liver, will go low, and that albumin keeps fluid in your blood vessels. So if you have low albumin, the fluid leaks out. Okay, heart dysfunction. So if your heart is not pumping properly, and then kidney dysfunction. So you want to tell your doctor, look, I'm having this swelling, so they can find out, make sure your heart's okay, your kidney's okay, what's your nutrition level, check for blood clots. And if it's all that and they've ruled everything out, then they blame it on the medication. Okay. So some of the things, if it's just based on medication, we could give you a diuretic, Lasix furosemide. You have to be careful. You don't want to take too much of that because then it dehydrates you. Avoid salty foods, hydrate with water. Okay. Keeps your legs elevated. Compression stockings. We have here a lymphedema clinic, and I think most centers do have a lymphedema clinic, and they can wrap your legs. And then you want to increase your protein intake and avoid very hot showers because within the blood pools. So you want to have room temperature showers, which isn't terrible to do if you're, in Florida, it's easy for me to tell people to avoid hot showers, and now that springtime, it's okay, up north in the cold, you want to have your, um, uh, um, oh yeah, why not to take magnesium? Sorry, I just saw this chat. Yeah, the magnesium can help. And so avoid hot showers. Okay. Skin and hair changes. Okay. Hair, we do have the hair loss with chemotherapy. Not every single chemotherapy causes hair loss. Mostly the most culprit is the doxorubicin, the dacarbazine, the ifosfamide. Um, Trabectedin, for example, does not cause hair loss, which is like, but I thought all chemotherapies cause hair loss. No, it doesn't. And eribulin at 50%, it causes hair loss. Doxil plus or minus hair loss. So not all of them cause hair loss. But if you have hair loss, you know, some people wear some people get the wigs, other people that's get the scarves and things like that. I think the main thing with the hair loss, it's very emotional. And I tell patients when you lose it, you're going to lose your hair and you're going to cry about it. And it doesn't mean you're not a strong person, and doesn't mean that that you're a vain, you're too vain or whatever. That's just what it is. So, we try to limit how much chemotherapy we give because of that, but we don't want to not give chemotherapy because of it, if that makes any sense. But um, other things, other treatments can cause hair thinning, and we want to make sure we check thyroid levels with that, and then whitening of the hair. So like Votrian and pazopanib and things like that can cause whitening of the hair. So we do check if you're not on chemotherapy and it's not expected, then we do want to check for lab abnormalities, vitamin B12, folate, thyroid panel. And when some people lose their hair, and then it comes back, and it comes back as white, or they have white hair and they don't like it, it's okay to dye your hair. I think it's fine. But if you want to rock gray hair, that's fine too. But I think it's fine if you want to just dye your hair. For the skin changes, you want to avoid the sun. The sun is going to make you sensitive, whatever treatment that you're on. You don't want to be a hermit and stay inside. You just have to make sure you're protecting your skin. Sometimes suntan lotions or sunblock can actually, like, some people are just sensitive to those. So really you want to get the shirts that are kind of the thin shirts, and a big floppy hat. And they have a lot of sun shirts, and the least you can avoid putting all the lotions on. And then you want to just making sure that you're protecting your skin. Other things that you can get, blisters from certain medications, rashes. So if you do get the blisters, this is mostly for patients that are on the oral medications. You want to avoid hot water, hydrate, use moisturizer with the urea-based products. And as soon as you see skin changes, the flaking and things like that, call your doctor. And then you can start it early. Don't let it say, oh, this is just normal. Now, the doctor may say, okay, that's normal, don't freak out, but at least, give the doctor a chance to be able to explain what is normal and what's not normal. But again, the treatment does make you sensitive, and that's usually normal. Like with chemotherapy, your nails are very sensitive, and we can actually see the rings, because what happens when you get chemo, you're making the nail, and then when you're not getting it, then you're like the cycles, you can actually see the rings when it's being made, not made, being made, not made, like rings on a tree. So you want to keep your nails, and so they're very weak. So you want to keep your nails very short, so they don't have a chance to lift up. And the toenails the same, you want to keep them short. and you want to avoid wearing heels with high heels, or even closed-toed, because that puts pressure on the toenails and then the toenail can come off. So you want to try to have open-toed shoes as much as possible. Of course, it's easy for me to say that in Florida.
Right.
Fatigue. Fatigue is another big one, okay? Every causes of fatigue, there's a lot of causes of fatigue. Pain, dehydration, depression, anxiety, anemia, vitamin B12, folate, iron, low thyroid, not enough sleep, not enough exercise, infection, poor nutrition, medication, and the tumor itself. So a lot of causes, so we want to address all those causes, okay? What is fatigue? Okay, cancer-related fatigue. It's unusual, persistent sense of physical, emotional, or cognitive tiredness or exhaustion related to cancer or cancer treatment that interferes with one's normal activity, okay? And the symptoms: feeling weak all over the body, difficulty concentrating, waking up tired after sleeping, lack of energy or decreased energy, lack of motivation to be physically active, increased irritability, nervousness, anxiety, impatient, no relief from fatigue, even with rest or sleep, and symptoms are present every day or nearly every day for a 2-week period within the last month, okay? So if you have 1 or 2 days that you're tired, it's not, I mean, it's fatigue, but if it's going on, we need to address it, okay? And what are the causes of it? We talked about the causes. What are some treatments? Hydrate, 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 okay? Again, I don't know if you're sensing a theme. You want to keep your pain level too. The same thing that can cause nausea can cause fatigue. Keep your pain level less than 2. Ask your doctor to do a fatigue workup. I do a whole fatigue workup. I check a urine, could be a hidden urinary tract infection. Again, the vitamin B12, the folate. Get at least 8 hours of sleep, okay? You're on chemotherapy, you're on treatment, you have cancer, you need more sleep, okay? That's the number one cause of fatigue, not enough sleep. If you can't get 8 hours straight, then get 6 hours and take a nap. If you were a person before you had cancer that needed 8 hours, then you need 10. If you were a 6-hour person, you need 8, okay? So you need more than what you did before you had cancer, okay? You know, some of these CEOs of big companies, they only need 4 or 5 hours of sleep. No, if you're not that, if you were that, then you need 8, you know, you need 6 or 8, right? But if you were a person that needed their sleep, you need more sleep. You need to exercise. Sounds counterproductive. How can I exercise if I'm fatigued? But exercise is a very good treatment for fatigue. Once you get into an exercise program, you will actually have more energy. Okay, and it's been proven. And prioritize your activities. So you want to figure out what your fatigue scale is, okay, what the number that describes you today. You want to have a fatigue scale, and then you want to conserve your energy. You want to prioritize. You may not be able to get in all the activities that you did before. So you want to say, when am I have the most energy? When I wake up in the morning, I am full of energy until 2 p.m. Well, if you have energy at that time, that's when you want to get your important stuff in. And then when you're meet with your friends, have lunch with your friends, do whatever errands you need to run that's important to you before you run out of energy. Okay, so you want to prioritize, and you're not going to be able to get everything in. Okay, so you have to prioritize. As we get older, we have so many more commitments. Now you have cancer, now you're on treatment. So you need to really prioritize your activities. Okay. And you want to conserve energy. There's ways that you can conserve energy. If you don't have enough energy, there's things that you can do. Okay. If you're unsteady on your feet, conserve your energy, use a walker. If you like to cook, but you can't stand up all day, get a high chair and do your cooking sitting, okay? If you have issues, even just bending down, use things to help you, okay? So energy conserving techniques, sitting to complete tasks, using a cart to push items instead of carrying them, avoid bending, use a reacher, breaking up components of the task, ask for assistance. I'm sure most of you were helper bees, and now it's hard for you to ask for help. It's okay to ask for help, okay? Spread the energy and do tasks that require the most energy at the time. And then you can take breaks, do a little, rest a little, and then implement relaxation techniques. Make sure you're taking your naps or your meditation. So again, energy conservation, pacing, priority, changing positions. Pacing, you got to figure out how much energy do you have? What's my level? How much do I have in the tank? If you have your energies 5 to 10, then you can use 2 levels of energy before you need to rest. So it's basically like, what's my energy level today? What tasks can I get done? Listen to your body. Don't do too much at a time. And prioritize your energy as well. Think about the time that we talked about. And then again, strategy, sitting, and things. Exercise. This is the most important thing. Published research has determined that exercise is safe for cancer survival and aids in the management of cancer-related fatigue on or off treatment, okay? So again, improved balance, flexibility, decreased pain, decreased activity, improved heart function, increased energy levels, and improved quality of life. So what is the recommended number of exercise? Aerobic, 150 minutes a week, okay? Of moderate intensity, or 75 of vigorous, or a combination of the two. So that means 25 minutes a day, a stroll, not, or maybe a brisk walk, okay? And we want to do resistance training, okay? Now, you don't want to go out and start doing anything by yourself if you're not a workout person, but your insurance covers usually like 10 or 12 sessions of physical therapy each year. And guess what physical therapy is? Free personal training, okay? So ask your doctor, I want a personal trainer. I want physical therapy. Can you write for it? Okay, you can write for it, and then they show you the exercises. A lot of cancer centers have survivorship programs and patients on cancer treatment. They have exercise programs that you can get involved with, wellness programs. So there's a lot of things that you can do for free. You don't have to have a gym membership. You don't have to do this alone. So you really want to get your exercise, and you want to be stretching. Okay, a lot of time you have to stretch. A lot of times, some of the chemotherapy, you get muscle aches, you get a lot of times people are like, my muscles just hurt so much. I'm like, well, have you been stretching? No, I don't stretch. Okay, you need to stretch. I tell people to stretch because I hope that maybe if I tell people enough to stretch, I will do it myself, because I'm not a good stretcher. But you really do need to, and there's a lot of apps for stretching. But again, if you can get your doctor to write for the physical therapy, that can set it in motion and really. So some of the aerobic activities, walking is an excellent aerobic activity, okay? It's not bad for the joints, and there's a lot of things you can do. You can do walk and talk. You can walk with your friend. Now, walking your dog is not exercise, okay? That's walking your dog is getting exercise, okay? That doesn't count, okay? Because you're on your dog's time, okay? The dog is stopping, sniffing stuff that shouldn't be sniffed and all that kind of stuff, okay? So you can take your dog for a walk, you can go get the mail, but that's not exercise. You need to have exercise as you time. You can either do that alone and you can use those endorphins, or go with a friend and do a walk and talk. There's actually I thought I had made up the walk and talk, but apparently it's in the psychologist's as a treatment. psychiatry and walk and talk is actually a treatment because of exercise helps with the endorphins and helps with depression. Biking, hiking, swimming, dancing, gardening. Not sure about gardening, but I mean, there's a lot of bending down, so you got to just make sure you're doing it. Tennis, sports that require running, marching in place, jumping jacks. I don't love jumping jacks, climbing stairs. Okay, that's good. And then here's some resistance activities. You don't need anything fancy. There's all kinds of free apps. But this is just, you can take a chair, you can do some buttocks exercises, squatting. You know, this is another thing good for your buttocks. There's other ones, upper body. Okay. You can use no weights, or you can take a bottle, 16 ounces, that's 1 pound bottles you can do. Okay. You can even do chair exercises. You have to talk, and then the flexibility, there's a lot of different stretching exercises that you want to do. You can do that while watching Netflix and TV, okay? Going on the computer. For me right now, I should be doing I try to sometimes do the stretching just while you guys could be doing these exercises right now while you're listening to me. Balance, you want to be always trying to do some balance activities, but you don't want to, if you're not used to those balance activities, then, try to do it with somebody. And then what to watch out for. Obviously, if you're exercising and you feel your heart pounding like out of your chest, or you're getting dizzy and you can't catch your breath, then you have to stop, okay? Leg cramp, headaches, visual changes. So if you have those, you want to stop immediately, okay? And talk to your doctor about it. Pain is another thing that it's not necessarily a side effect of treatment, but it is a side effect of cancer, and it's subjective. It can cause all these things: irritability, decreased appetite, nausea, vomiting. So you need to find out what's causing the pain, and use this scale. We used to use this scale, we want people smiling. Okay, so we want the pain to be controlled. I tell patients, if you're no longer smiling, which is about a 2 to 3, you need to start taking your pain meds. If not, and you let it go, then it goes to 8. You actually have to take more pain meds than you did if you would have if you wouldn't have waited. You're backpedaling. If you wait, no, I'll just wait until I start crying. No, if you had it at 3, you only need 1 pill. But if you wait till 8, 3 pills, and it still may not work. Okay, so, and plus, why do we want to have frowns on our faces? We want to be smiley. Okay. So again, some things you can do: keep a pain diary, figure out, is it certain medications, is it certain foods, when are you getting the pain? The best way is narcotics, okay? I know it's all the rage, the opioid crisis and all this stuff, but that is from people that don't have cancer that were abusing this medication, and the company's marketing to non-cancer patients and telling non-cancer patients that they should be taking these medicines, and really it's for cancer patients. And I haven't had any cancer patient get addicted to pain medicines because it goes to the pain receptors. So we usually keep with a short acting pain medicine, then we can go to long acting pain medicine. Mental effects, memory issues, anxiety, depression, stress. Do talk about chemo brain. You hear chemo brain. Some of our medications can cause some cognitive changes, and we want to be on alert for that. Most of those changes could be related to some of the pre-medicines that we give you, some of the steroids and some of the nausea medications, which is transient, okay? Some of our mental changes is anxiety. People think they forget most memory loss, right? So that's some of the cognition changes. Memory issues is usually stress related, okay? I kind of tell the difference between stress related and like Alzheimer's or really dementia, and that usually it's related to someone's going to the kitchen and they forgot what they were getting. They're going to one room and then they go into the room and they're like, I don't remember why I came here. Okay. Why don't you remember? Because you're thinking about, I got the doctor's appointment, I got the scan, I got this, I got this. You're thinking about too many things. Now it's different if you're driving home and you forgot where you live. That's a different story. Okay. But that's rare when it comes to treatment related. It's not really going to do that to you, but you will forget some things. Some of the Ativan and some of the things can make you, Xanax, that can make you forget things, which may be a good thing, right? You forget about all of that stuff. But it's mostly stress because your brain is thinking about too many things and you're forgetting. So you do want to be writing things down. Okay, but it is common that patients that have had chemotherapy, they can't, they do now. It's like, if I don't write it down, I'm not going to remember. But also people are getting older. If I don't write stuff down, I'm not going to remember it. It's not going to get done. So you do want to be writing things down so you remember what to do, and don't get upset when you go, so when you find your keys in the refrigerator and think that you're losing it. No, you just have a lot of things going on. Okay, eventually you find those keys and they're in the refrigerator. And then, or you find, something where you're like, oh, I can't believe it. It's on the top of the refrigerator. You don't even know how it got there. Okay. Which I've done that, not on chemo. So again, we want to make sure that you're talking to your doctor about your mood changes. Majority of patients that I have, we send to the counselor, okay, to get fully evaluated, okay, because it's a lot going on. We want to treat your entire body so you can get through the treatments, okay? So we have Scanxiety. We all know about Scanxiety. I'm trying to get it in the Wikipedia. I think it's in Wikipedia. I think we should get it in Webster's, at least on Google, you could see it. But the internet, the news, family issues, negative Nellies, okay, and anxiety, depression, okay? So how do we deal with Scanxiety? What I try to do is try not to have your doctor, you get the appointment and then the scan is 2 weeks later and it's like you're waiting around, okay? Now, the problem is if you're getting your scans at a center and you're getting your scans on the outside and then you got to wait and then they have to wait to get the results, that's a problem because, then you do have to get it later on. But if you get it at that center, usually they can get the results within a week, even a few days, okay? But if you're getting outside scans, that takes longer, okay? But I have some patients that are so anxious, I just say, just come to see me the same day. I'll get the scans. I'll give you a preliminary result. I can eyeball it and tell you if it's good or bad. And then we'll wait for the official result, but you may have which the radiologist may change the results. So you want to schedule it close. Now, sometimes I'll have patients, we schedule it close. 2 days later, I got the scan, appointment. 2 days later, the appointment with me. Oh, whoops, they had to change my schedule because I had a trip that I forgot about. And then they change the schedule, but they don't change the scan. And then they change the appointment to 10 days later. So if they ever call you from the doctor's office and say, oh, we got to move your appointment a week later, tell the scheduler, oh, can you move my scan too? Okay. Move it closer to, don't forget to move the scan also. Limit the internet. I love the internet because I'm able to do this because you guys have a good internet influence, but you can see there's a lot of negative things on the internet too. The news, I personally do not watch the news, okay? I have my husband filter the news for me, and people talk about stuff at work. Like if I knew the world was coming to an end, I probably, like someone would tell me, okay? But if you watch it, it's just too depressing. So it's like you can either have cancer, be on cancer treatment, or watch the news. You can't do both. Okay. So I'm an oncologist. I can either be an oncologist or watch the news. I can't be both. And then relinquish control of family and friends issue. Like you just have to like let them deal with the stuff. You can't be dealing with other people's problems. You got your own problems. You can't be dealing with other people's problems. And you want to be avoiding negative people. Okay. And these negative people, they don't even realize that they're negative and they try to help you, but they're really not helping you. They're kind of hurting you. So you just kind of try to avoid them. You don't have to get in a fight with them. Just know this person's not good for me. I need to avoid them. And then you have to have a little bit of denial. I like a little bit of denial. Okay. I think it's not that bad of a thing as long as you go to the doctor and, don't ignore things and don't go, you still need to get your scans. You still need to get treatment, but you don't have to be always thinking about it. You can think, oh, you know what? I may have cancer. I may not have cancer. Who cares? I'm getting my treatment. I don't have to think about it all the time. So a little bit of denial. And then you have to have your escape mechanism. When you notice that your brain is wandering off, you're allowed to cry, you're allowed to be mad, you're allowed to be sad, you're allowed to be angry, but you have to figure out a way to nip it in the bud. Okay, I'm going to be crying for 5 minutes. I'm going to be screaming and yelling for 5 minutes, and then I need to have my escape mechanism, whether I'm going to pick up my phone and look at a cute little doggy or whatever I'm going to do, or watch a funny video, whatever it is, or meditate and think about the beach, whatever I need to do to have my escape mechanism. So you have your pity party, you clock it in 5 minutes, pity party. That's it. I'm stopping. Deep breathing. Breathing is very, very important. Okay. Deep breathing. That's why people think that smoking cigarettes is relaxing. What are they doing? They're taking a deep breath in and out for 5 minutes and then blowing out. And they're doing it. How long does it take to smoke a cigarette? 10 breaths, right? That's exactly what they're doing. So, and they think it's relaxing. It's not relaxing. It's actually increasing their heart rate and increasing anxiety, but they think it's relaxing because they're removing themselves from their environment and they're just taking deep breath in and out. And you do that 5 times, you do that 10 times, and you release different toxins, you release different endorphins in your body. Meditation is also very good. I've tried it myself. And the thing is, I failed at it and then I don't do it. And then I actually talked to a doctor. I went to a lecture recently who was like kind of not an alternative, but a holistic kind of doctor that works with oncologists. And I asked him about the meditation. How do you do it? And he says, you don't have to be perfect at it. Everyone thinks meditation means that you have to completely black out and don't think about everything. No, you just have to spend time just relaxing, closing your eyes, breathing, and try to block out stuff, but you don't have to block out everything. And you don't have to meditate for half an hour. You can just do like a little bit, just touch 5 minutes, 3 minutes, try to get better at it. But there's a lot of apps you can use and they're free. Okay. And then if any issues, if you're depressed or anxious, those are normal thoughts. But if it's interfering with your eating, your sleeping, your daily activities, and your relationships, then you need to be with a counselor and you likely will need medication. Okay. And it's okay. You're already taking a bunch of medication. What's one more pill? Okay. Depression, again, same thing. There's major depression, which we can, I'm almost done. So major depression, which is SIGI caps, problems sleeping, problems eating, loss of interest, loss of concentration, loss of energy. Pain can cause it, fatigue, a negative environment, and stress. So we want to address the pain, the sleeping, the eating, avoiding the negative Nellies, cut down on the internet, and, think of hope and living with cancer. Okay. And then you may need antidepressants. All right. So in conclusion, there's much hope for the LMSers. Okay. Focus on the hope, hydrate, 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 get your rest, exercise, take medicines to counteract the side effects, which may mean that you have to take medicines to counteract the side effects, the medicines that counteracting the side effects. Okay. Tell your doctors how you feel physically and mentally so they can help you. We didn't go to school for all these years. We went to school for all these years so we can help people. Okay. We don't do it for the money. We do it for the helping people. But we can't help you if we don't know the problems. So you have to speak up. No watching the news. And thank you, everybody. Questions?
Yeah, thank you, Gina. Thank you very much. So there was one in the chat. It
Okay.
says, many chemos cause lower white blood cells. How can getting colds be avoided?
Mm-hmm.
And it seems my colds are much worse than other family members.
Mm-hmm. Mm-hmm. Yeah. So, I mean, most treatment, chemotherapy in particular, does lower your blood counts, okay, and does make you susceptible to infections. Now, it's not all the time, okay? Usually, when you get the chemotherapy, your counts go low, and then they bounce back up, and then you're ready for the next chemotherapy. So you're really only susceptible during those like low points. So there's some things you can do to avoid it. One, that's why we give the growth factors. We do the Neulasta and the injections to try to shorten the time. It doesn't prevent the counts from going low. It just shortens the time that they're low. So it shortens the time that you're susceptible to infections. If you wind up in the hospital with an infection or a fever after your first cycle of chemotherapy or after a cycle of chemotherapy, the next cycle, you can ask your doctor to put you on antibiotics to prevent the infection. And I do that with some of our stronger chemotherapy regimens, especially doxorubicin and ifosfamide. We will give it as a preventative. As far as colds are concerned, that's more of a virus. And yeah, how do you can avoid it? I mean, you want to be getting your flu vaccines for sure, but the colds, you want to be washing your hands. You want to be more cognizant of the people around you. Kids, I mean, a lot of people have kids, so you can't really avoid them. But maybe other people's kids, maybe you can avoid, or just kind of be noticing. If you notice someone is coughing or sneezing, you want to try to avoid that person, or so that's kind of what I do because I can't afford to get sick. Then I have to cancel clinic and everything. Like, so for example, we had a friend, like I heard someone, they were on the call, they were having congestion, and then they wanted us to go to trivia night. I'm like, no, I was just on a call with this person. They have congestion. I'm not going there. So you can kind of, try to avoid it that way. I don't think you have to go walking around with masks or anything like that. And you can also tell people that if you're getting together with them and they're like, listen, are you feeling okay? Or, you can kind of say it in a way like, oh, so yeah, I'm excited to meet you. Now you're feeling okay, right? Because I can get sick, you can kind of say it like that. And then they're like, oh, actually I may. Because a lot of time, because you're really only susceptible when that person actually has their like really symptoms and like if they're sneezing and coughing, that's when you can get it. So if you notice it, you kind of, turn away. Now there's people that could, replace toothbrushes often. That's true. And like sharing food. I mean, you go to a restaurant and it's like you can't help it, oh, let's pass the spoon around, oh, taste this drink and taste that drink. You really try to avoid that, try to avoid sharing. Like if you're notice you're at a restaurant together, and then you're sharing one appetizer or whatever, ask the waiter, do you mind bringing over a serving spoon? You can still share it, but just don't use that serving spoon, and kind of notice that, or just don't share it. But it's hard because you don't want to be rude, but you just have to say, oh, I just have a weak immune system.
Other questions?
Okay. Can Taxotere cause heart issues such as SVT? It's rare. Usually the medicines that cause the heart issues are doxorubicin chemotherapy, but nowadays We check an echo beforehand, and we usually, most doctors give it with a cardioprotectant called a dexaroxane, and you want to have that from cycle 1. The FDA indication is after cycle 4, but you want to start at cycle 1 so you can get more in. You can get cardioprotected the whole time. And then a lot of the tyrosine kinase inhibitors like Votrient, some of those can cause it. Now, Taxotere, it's possible that it may be some of the pre-meds like the Decadron, because you do get steroids to try to prevent the fluid retention with the Decadron. With the Taxotere, you can get some fluid retention. So it's possible that it could affect your heart, maybe. But it may be something else going on. You may want to be checking the thyroid and some and things like that.
Any other questions? And people can unmute and just ask too. You don't have to use the chat. See, it was so comprehensive, Gina, that we don't have any questions.
That's what I try to do when a patient comes to see me. I try to go over my spiel, and then I ask, oh, any questions? And then they're like, oh, well, where's the bathroom? I'm like, good, I covered everything. Anyways, let's see. What are the long-term effects? I had a very bad fungus in the dung, the previous chemo a few years ago. So there are long-term effects of chemotherapy that we know about. One can be, certain chemotherapies, not everyone, can cause a secondary cancer. Doxorubicin and ifosfamide can. So that's why if you've been on those chemotherapies, we want to make sure we're checking your blood counts. Other long-term effects are infertility, possibly. So if you're at a childbearing age, you want to talk to your doctor before you start on any treatment about fertility preservation. Now, the question about infections. There's not really good studies to show that chemotherapy can make you more susceptible to infections in the future. I do feel that it can happen. My sister had chemotherapy back in high school, that's what got me into it. She's in her 50s now, and she's susceptible to infections, but it's like, you don't know. Were you susceptible to infections and that's what caused the cancer, or is it the chemo that caused the cancer, right? Or the chemo caused it. So it may. Now, a bad fungus in the lungs that could have formed, usually that would be during the chemotherapy. If you've been on prolonged immunosuppression, usually that would be more of someone with a leukemia or a leukemia where they're on prolonged times without from the chemotherapy, and the where they're more susceptible to fungal infections. The chemotherapy that we give for sarcomas, at most you're going to have the low white blood cells for a week, with the Neulasta and everything. And usually the low white blood cells for only a week usually is more bacteria than fungus. But anything is possible. So you do want to be monitored closely if you've had chemotherapy before. There's not really much we can do as far as boosting the immune system besides exercise and fruits and vegetables. I mean, you can go buy stuff on the internet, but that's nothing really proven. So I would just go with you don't need to take high doses of vitamin C or anything, but a spinach package, for example, has a lot of protein. It even has protein. It has a lot of vitamin C. Your fruits and vegetables, you should get those in. And then, yeah, if you're on surveillance, for example, and you see a lung nodule, that may be an infection, may not necessarily be your cancer. If you're on Yondelis for a year, can that harm you? So Yondelis, no, I've had patients on it for many, many years, actually. I have a patient on it for like 4 years, especially for myxoid liposarcoma. So far, we haven't really noticed any long-term effects from the Yondelis. Can cause the cardiotoxicity similar to the doxorubicin. So we do want to be monitoring with echoes. I would say every 3 to 6 months, if you are going to be on it long term, you want to be monitoring your heart. There's not really a heart protectant we can give for the Yondelis. Let's see, what's the name of the cardioprotectant drug? It's called Zenocard. Someone did answer that. What are the long-term fungus? What's the name of the cardioprotectant? There was something else. Wait, how many chemo, white but cold, toothbrushes, chemo. Oh, she took the
That's all
red
I
devil
see.
chemo. I
Yeah.
see the red devil. We're no longer calling doxorubicin the red devil. It's the red angel. Okay. The reason why it was called the red devil was because it was caused really bad nausea, and that was before we had Zofran, and before we had Aloxi, and before we had olanzapine, and before we had Ativan. So everyone was really sick from that. That was what my sister had. We didn't have Zofran back then. I still have post-traumatic stress watching her vomit. Okay. So that's why it was called the red devil. But now it's no longer the red devil because we have side effects. We can manage all the side effects, and we can do the heart protector as well. So we're going to rename it. I don't know if we want to rename it the Red Angel. We can come up with a name here. The LMS group can do it and get back to us. Can always like the creative approach, but we're not calling it that anymore.
No more red devils.
No,
Okay,
no,
good.
or red devils. There's a lot of words we can't say anymore that we used to say back in the day. So, we have to kind of change some of our language. So that's one of the languages that we're changing. Okay. Bone broth. Yes. Bone broth. I heard a lot of good things about bone broth. I think that's something benign, that's cheap, and it's good for you. So yeah, I'm a fan of that. What else? One more.
What about using red light therapy?
For what?
They didn't say.
Okay.
Is that for getting rid of cancer, or can you write in the next for cancer and well-being? Yeah. So I don't even know what it is.
Okay. 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 Oh, for cancer, Mom. I would try to avoid anything that's expensive and not proven. If it's cheap and it doesn't have any side effects, like swishing your mouth with
Broth.
baking soda or drinking a little bone broth. But if it's expensive, it's probably a scam. Okay. Will the deck be available? Yes, I can email it to I can email it to Sharon.
Yeah. That sounds good. Well, I think
Okay.
that's it.
Okay, yeah, I'm getting in trouble. Apparently, I was supposed to have dinner with my husband for our
Oh,
anniversary.
no.
Like, what? I know he's texting me. So anyways, it's fine. That
Okay,
is fine. I'm
we'll
getting in
wrap it
trouble.
up.
Okay.
So thank you so much,
Okay.
Gina. We really appreciate this. It was very,
Okay.
very helpful.
Yeah,
So
no
everybody
problem. All right, take care.
give
All
her a
right,
virtual
bye.
clap. Yes,
Okay.
thank you. Have dinner.
Bye. Take
Bye-bye.
care. Bye.